We're rolling? All right, great. So again, we're just going to ask you some basic questions.
Sure.
For starters, this is a real easy one. For the camera, if you can just state your name and spell it for us.
Gee, that's not a no. Michael Keefer, K-E-E-F-E-R.
Great. And if you can also state for the camera there your job,
Yeah.
and what affiliation you have.
Sure. I'm the principal investigator at the Rochester HVTN clinical research site. And I've been doing this work for 24 years.
Great. Okay. So the first question is real simple. Mm-hmm. And your thoughts, your opinions here. Why is the AM study important?
Okay, this is a tremendously important study, mainly because of the development, or the discovery really of these antibodies that are broadly neutralizing that develop in a subset of patients. And I mean, this is probably our holy grail in the vaccine field, if we could only make a vaccine that would induce these antibodies. And having these antibodies in the vial to be able to give them to people is a major breakthrough, and it's going to be a major it's going to be a very important study to determine whether these antibodies are exactly what we need to produce with a vaccine.
And to that end, if you can describe briefly with the AM study, who is it going to impact the most, you feel?
You know, like any study, it has the potential to impact really the world. I think at our site, we're specifically trying to reach out to the people who need to be on preventive measures like PrEP, or in a study like this, people who fall between the cracks. In our study, in our city, we're really reaching out to the young Black MSM and Latinos as well too. And we're trying to not only get them into these studies or get them onto PrEP, but also engage them in the healthcare system and some of the support systems that we can have. So at least locally, it's going to be the group that really has the highest incidence of HIV and needs the help the most.
Now I'm going to ask this question. It's really a repeat of an earlier question,
okay,
but it's stated a little bit differently. What is most exciting about AM?
I've been in the field for a long time, and I know there's been a certain tension between the vaccinologists who classically have just kind of empirically moved ahead with vaccine studies, and usually they work, or often they work, and the basic scientists who want to precisely define or understand the mechanisms. And we left the study of antibodies for a number of years because we didn't feel we adequately understood them. In this case, this is the product of the basic science work and the development of these broadly neutralizing antibodies. So this is kind of a culmination of some of the early efforts that have taken quite a long time to get here. So this is kind of a landmark study in the history, in the 25-year history of AIDS vaccine development.
And again, I'll ask this question in a repeat. What would you want others to know about AMP? And I would say others because you are an investigator.
Right.
What would you want to tell other investigators about the AMP study?
Well, I think this holds the best hope of really directing us to a breakthrough in vaccine development. Of course, we've been wrong before, and the studies of the results of any study are not guaranteed. So we need to work as carefully as we can with this study to get valid answers, and then move on from there. It's always been an iterative process, and I think this is a major, potentially a major fork in the road for the field. And over the years, everybody's participation has contributed to us to get here. Thousands and thousands of volunteers have participated in our different trials, and this is a culmination of some of those efforts in certain ways.
And let me ask you now, you mentioned it with vaccine research. Why is vaccine research important?
Well, vaccines are probably the single most cost-effective way of dealing with infectious diseases and even, certain cancers with the HPV vaccine. So if we could further arm the immune system to take care of this and other diseases, we could actually probably fix some of our problems with the healthcare system in terms of expense. For a public health measure, vaccination is kind of right up there with sanitary water and sewage. I mean, those are really the two major contributions to the health of the public over the past couple thousand years.
So in your own words, can you describe for me, so there are two networks here, there's the HPTN and the HPTN. In your own words, you can discuss both or one or the other, but just kind of give me a general sense of the work that the organizations are doing from your perspective.
Right. Well, the networks are aligned very closely in mission. It's supposed to both to find a prevention for HIV acquisition. Typically, the vaccine network, is more restricted to active vaccination, meaning giving a shot that then creates the antibodies. The HPTN, the prevention network, of course, has been pivotal in the development of PrEP, done the major studies there, and that's a medicine that's given to prevent infection. Of course, the medicine has to be taken either daily or maybe there's going to be longer acting preparations, but it has to be given more than once in a lifetime, perhaps. I mean, the ideal vaccine, one shot, you're good forever. Not all vaccines are quite that ideal, but nevertheless, the adherence and the amount of times that you have to come into contact with the health system to be protected, I think everybody is preferring anything that would last forever as opposed to something that would need to be repeated every day.
Great. Last question here for you. Mm-hmm. Now we know AMP is an acronym.
All right.
So, in your words, or we'll actually make it in one word, what does AMP or the AMP study mean to you?
I've been in the field since the very beginning. The earliest preventive vaccine given to people we did in Rochester. I was in my training then. I did some of my training laboratory work there. I may not last until the very end, as far as my career goes, but this would be a watershed moment of real progress. If we find that this works, this defines where we've got to go next. That was more than one word, but... So
I'll re-ask the question then. If you can just give me one word that describes the AMP study, the significance or the potential impact of AMP, what is that one word for you?
Groundbreaking.
Great.
Anything better than that?
Let's keep going. Rather than making it a question, you can make it a statement. Again, what's that one word for you?
The one word is groundbreaking.
Perfect. Great. Thank you so much.
Okay.